Bismillahirrahmanirrahim. Assalamu alaikum students. Today I will be very briefly discussing with you oral glucose tolerance test. Students, oral glucose tolerance test is used to diagnose pre-diabetes stage. Oral glucose tolerance is used for the screening of gestational diabetes mellitus in pregnant females. Oral glucose tolerance test is used to diagnose type 2 diabetes mellitus when the patient is having all the signs and symptoms of hyperglycemia, but blood glucose levels are not indicative of hyperglycemia. Students, it's a very simple test to be performed. A 75 grams glucose is given orally to the patient and blood glucose level is measured at 3 different time intervals. First of all, before giving 75 grams of glucose, blood glucose level is measured. This is called zero time. Then after 1 hour of glucose intake, and then after 2 hours of 75 grams of glucose intake. Students, after 2 hours of glucose intake, a blood glucose level of less than 140 milligram per deciliter of blood is considered normal. A blood glucose level range from 140 to 199 milligram per deciliter is considered as a pre-diabetes stage after 2 hours of glucose intake. And a blood glucose level more than 200 milligrams per deciliter after 2 hours of glucose intake is considered diabetes mellitus. So we have 3 blood glucose level ranges: 140 milligram per deciliter. Less than it is normal case. Between 140 to 200 or 199, it's a pre-diabetes stage. And above 200 milligram per deciliter blood level, it is diabetes mellitus. Thank you students. Allah Hafiz.